Hey everybody, this is Jane with Barlow Herbal, and we got Dr. Brandon Nielsen in the house, October 2018, and we decided to get together and talk about how to get ready for the flu season and some of the things that's going on out there.
Yes.
About apparently there's some kind of nasal vaccine. Anyway, so we were talking about that, and I wanted to share it with you guys.
Yes. So here we are, flu season. Let's
Ugh,
talk a little bit about things. What do we want to talk about? Just a vaccine or how we can prevent inflammatory
all of
cascades,
the above.
infection. Okay. Let's see what we can do. All right, you guys. So to understand this, the CDC just released that they are going to start doing a nasal flu vaccine. Now, this is very smart because 90% of all breathing takes place in your nose. Some of you think that you're mouth breathers, and that's okay, but 90% of people are still breathing through their nose. That's how it was intended. Moistens there. You have natural bacteria in there to fight against the pathogens that are coming in. But it's interesting that they're finally going to a nasal route. Now, that being said, when you think of infection, so where does infection come from? Infection right now, there's spores in the air, there's virus in the air, there's bacteria all floating around us, and so really it matters though, are you boosting your immune system? Um, so infection is when a pathogenic microorganism enters your body and starts to multiply. Disease is when that infection or that microbe starts to cause damage to the tissue of your body. So you start getting the symptoms like the runny nose, the coughing, the aching, the chills, the fevers, those type of things. That's when disease is actually set in. So what is it that you can do? Of course, we're going to mention LDM. How does LDM work, and how do herbs work, and did we want to talk about adaptogens at all?
Sure.
I mean, yeah.
Yeah. Let's
Let's
talk
talk
about.
about how LDM works, though, you guys, and how vitamin C even works. Because there's a lot of controversy, like is vitamin C good or not good, and vitamin D and vitamin A. All right, so what LDM does, so as I said, infection, multiplication of the bad stuff, the germs, and then disease happens when they get so big that, or so much, they start to control that area of the body. So the cardinal signs of inflammation, and then you have what's called an inflammatory cascade. So the four cardinal signs of inflammation would be, um, let's see, rubor, which is redness. So like a throat that's red, that's inflammatory response to an infection, right? And that disease process. Then of course there's calor, which is heat, and then we have tumor, which is swelling, and then dolor, which is pain. So
And what are
red,
those Latin?
yeah, Latin,
Oh,
yeah.
I was gonna say what? I've never heard of those. What
Yeah,
is
so
that?
redness, heat, swelling, and then of course the pain. All right. So think of that like if you have a sore throat. So how do we stop that inflammatory process? How do we stop that disease in its tracks? Because what that's telling us is our body's doing the right job. How do we stop that? And what the LDM does, it'll actually help upregulate that process to be able to fight against infections. So sometimes people, some of the really purists say, well, don't take an herb because then you're going to actually just kill the disease.
Who would say that?
Yeah, people say that. No, it's not true, you guys. Herbs don't go in there and just kill a disease. Like if we took a petri dish and we took viruses and dropped LDM in there, just the herb, no tincture, let's just sprinkle the dust in there. It's not going to kill it. All right. What kills the virus, what kills the bacteria, the fungal, the spore, it's our body, it's our immune system. So LDM, again, the lomatium dissectum multifidum, upregulates, again, Latin, upregulates our ability to fight the infection. All right. So then things like vitamin D also upregulate. So when I think of like chest, I think of vitamin D. When I think of eyes, more symptoms towards eyes, that would be vitamin A. And then vitamin C is just a general good immune booster. But the LDM, you guys, is one of the best. I don't know. Does that help? Does that help people understand what infection is and disease and
Yeah,
that
in fact, I've
process?
really never heard when you said there's purists who say don't do herbs. Like I don't know anybody who's that. What?
Some homeopathic people will say it. Some of the
Oh,
homeopathic community will
hmm.
say, don't use herbs because then, no, you guys, it's like saying don't eat.
Well, no, I agree with that
It's
totally.
like don't eat. You guys, herbs are just food, it's plants. Don't eat. No, you still eat. You still use herbs. You can still use them in conjunction with homeopathy. But again, the herb isn't going to go and kill the bad bacteria for you and just wipe it out like an antibiotic.
So it basically lets the immune system do its job.
Yes, it upregulates, meaning it now makes it alert. So some herbs will help alert the body that, hey, there's going to be a pathogenic response, or just upregulate like your helper T cells, or increase the production of neutrophils or monocytes. Those things that are actually going to go out and help kill the pathogenic agent.
Okay, so tell me about what your opinion, even though we talk a lot about the rash, it's been a long time since we've talked about the rash.
Yeah.
So I know in your practice you see a lot of rash.
Yes, I do.
So what is yes, yeah. I talk to a lot of rash people. I mean, we're both kind of at the front lines.
Start a club, the rash club.
The rash club. I don't think the people who
no,
get the rash
know,
want to be in the rash club.
I know a lot of people have had it. So
yeah. So what would you say? Like, what do you have some insights that you could just share with people? Maybe there's some new people who are watching this who haven't used any lomatium and they're scared or nervous to use it.
Yeah, I mean, I think the biggest thing is you guys, you're going to be fine. I think the best summary described it like this. I was treating a patient in California. Her son had an allergic reaction to a vaccine, had a fever. His joints, speaking of joints, we're just talking to a doctor about joints. Anyways, he couldn't move. He was basically lifeless on the couch. And was the coolest thing, she went to one of her pediatricians who was the wrong doctor because her son got the rash. And it was so cool because he said, you know what, that's just a die-off from a viral load. I mean, he's like the only pediatrician I've ever heard. Yeah. He actually admitted that it was a die-off from a viral load. He didn't say it was from the vaccine. He didn't admit it that far, but he said your son's going to be totally fine. It's not contagious or anything like that. It's miserable. It's itchy. So let's talk about some things that you can help to curb it. One of the things that you can do is actually make sure that your liver is working optimally. Another thing that you could do is use the immunity boost, because it has some of the red root and some of the other things that will actually help, the dandelion, to help kind of cleanse the liver naturally. The other thing that I do is I start people really, really slow. Unless you're in that acute sickness and I've got to bombard you and it doesn't matter. A lot of times people are like, I don't care at that point whether I get a rash or not. But if the case is that you want to start boosting your immune system, one thing that I've done with a patient is, and we've actually got numbers on this. How do I know it upregulates immune system? Because I have a case study with increase of white blood cells. So you guys start on it really, really slow. Take some liver support. Glutathione. You can take anything that's going to help produce glutathione, dandelion, milk thistle, those type of things.
And we do Liver Love, which has all those things in it. So
perfect.
So I want to go back to what you were talking about as far as the nasal thing. Like
the CDC or what?
No, so what you said, they're actually doing a smart thing by bringing out a vaccine that you can inhale through your nose.
Yeah.
But we still don't want to take the vaccine, right?
Well,
I mean, what's your opinion about that? Because in the beginning,
I mean, who are you sending this to?
Well,
you guys, you got to do your research on vaccines, okay? You got to really do your research. But the best medicine is your own immune system.
Right. So let me ask you this: is it something you would do for you and your family?
No.
Well,
why would you do that?
Well, I know that's how
You're
I
gonna
feel.
get some comments below.
If people go,
like, why would you give yourself? You guys, you're already breathing.
I agree.
In,
but to me,
I would rather say, you know what? I'm gonna boost my immune system. Why am I gonna give myself an infection that you don't even know? It's like you don't even know. You guys, last year it was the worst flu season we've had in forever. Oh, you're fine. The worst flu season we've had in forever, and people still took the vaccine, and it was the wrong one. It was like, why would you do that?
Yeah.
You know?
Well, the only reason I wanted to bring this back around to this is because when you first started talking about it, you said that actually was a smart thing because we breathe through our nose. Well, and then we left off.
I'm sorry.
Someone's like,
oh, do we need to redo this? It's like the smartest thing they've ever done, but it's still not. they could do something else.
I don't think we need to redo it. You know why? Because look, we're almost at 10 minutes.
Oh, okay.
And I think if people, if they get this far into it, that they're
You're gonna
like,
be like Dr. Nielsen supporting. Anyways, it is what it is.
no, I don't think it sounds like you're supporting. But to me, that was a tiny bit
Yeah,
confusing.
I'm glad you brought that up.
Yeah. So cold and flu season is technically upon us because it's October, it's middle of October. And I think that if you keep your immune system going strong, eat right, make sure you drink plenty of water, make sure you're getting the right supplements,
And sleep.
and plenty of sleep. In fact, there's so much that goes wrong if you don't get good quality sleep.
Oh,
You know, I mean, so much that can go wrong if you don't get good sleep. So I hope this wasn't too rambly.
I don't think it was. I hope it's good info.
Well, we're still recording, so. All right, guys. Well, I hope if you got to this end where we're almost at 11 minutes, let us know if you have any questions and give us a comment below if you think that Dr. Nielsen is crazy. I'm just kidding. I'm just kidding.
It happens.
It does happen. But yeah, so personally, and I'm not giving you advice, but personally, I would never do a flu vaccine, even if it was in a good way to get stuff into your system is through your nasal passages. It would not be something I would do. I would do colloidal silver before I would do. And you said you're getting ready to do a colloidal silver.
We're getting ready to do a big campaign on that. Just yeah, this is the gateway. This is the gateway, you guys, to cold and flu season right here, the nose. And the other thing that we do is a probiotic specifically for the nose. We're coming out with it. It's so awesome.
Is it a nasal spray too?
No, it's not a nasal spray. You actually ingest it, but it's so cool. We've had such good results with it.
Nice.
Just for the nose. It's not. I know nobody else is thinking of doing this. It is just for the nose.
Well, do you remember when we talked about the mastoid bone?
Yes.
And putting something on, to absorb into the mastoid bone.
Yes.
I've had some really good results back with that with
Isn't
people.
That cool?
It's really cool.
Ear, nose, throat. Yeah, we're coming out with two probiotics. One is the ear, nose, throat. The other one's general respiratory, and it's crushing it. It's awesome.
Good. That's good. Well, thanks for listening. If you got to the end of this, it's been 12 minutes. So we'll see you guys next time.
Thanks.